Can I please get the iced Goldie?
Goldie?
Yes.
Thank you.
Have a good one. Woo. The iced Goldie from Microdose in Orange County. If you like cinnamon and vanilla, by far probably one of my favorite drinks, actually, my favorite coffee drinks in Orange County. I am on my way to my favorite aesthetics place for wine aesthetics in Culver City. I am getting the Micronjet under eye. I've been waiting to do this. Just let you know that it looks kind of crazy, but it's supposed to help with dark circles. I'm also going to see if I can get it done on my smile lines, because you can also do that. And I just can't wait to see the results, because I've been wanting to do this for a really long time. You can't tell right now because I do have a little bit of concealer on, but we'll obviously take that off before I get it done. And yeah, these are the smile lines. You'll see the under eye whenever I get there, because we'll go ahead and get some before and after photos, and I'll take a video before then too. So let's go ahead and go do that. This is why California is confusing. Like, make it make sense, people.
It increases swelling when you work out.
Right.
And we introduce something.
And my skin is sensitive, so I have a feeling I'm gonna swell.
Probably. Mine swelled pretty significantly, but we're not injecting like deep, we're injecting into the like very superficial dermis.
Okay.
And so by the end of the day, your skin and your epithelium is gonna absorb everything. So it just takes time. However, the puffiness is from like the action of the polynucleotides or the peptides that's happening. That's
right.
What, it's doing what it wants to do. That takes like about a day to 2 days to fully go down. So totally normal if you're like, feel like puffy
Okay.
tomorrow. The next
Yeah,
day.
just as long as I've literally seen videos of girls that look like X-Men. They look.
Yeah, you won't look like, with the dots.
They look
You'll
like
have those
a
today.
mutant.
You'll have a mutant eye today. This is like a new technology, and it's so simple, but it's so cool, and I nerd out about it all the time. What makes this so cool, especially in terms of using skin boosters for treatment, is before we had this fabulous little tip, as injectors, it was our job, if we were introducing something just in the dermis, just for a skin booster. This is not filler, we're not injecting deep into the fat,
Right.
We're not injecting deep on bone. It's only safe for skin boosters to be in skin. So to be consistent and safe and get an actual needle that depth every time is nearly impossible, right?
Okay.
At some point you're gonna go a little deeper, or maybe you go too superficial.
Right, and doesn't do anything.
Yeah, it doesn't do anything, or you cause a bruise, or people leave, just looking really beat up. This makes it so that every injection is in the correct layer, correct plane.
Yes.
And we're getting our stuff where we want it. This is putting it, we're skipping the microneedling part and we're laying it right under the skin. So your skin's getting everything, the whole syringe, whole vial.
Cool.
This one specifically is for hydrating and like boosting skin texture, skin quality. It has niacinamide, it has glutathione, it has B vitamin in it. We're not gonna use this one for under eyes, but this would be something that you would use on somebody with like really textured, kind of crepey, dull, dry skin.
Right.
This is another one. This is called NAD, and I'm sure you've heard of NAD. It just helps brighten and firm skin. And I'm treating under eyes. What are like the biggest things that we find? Dark circles.
Right, which is the same. That's what I want. Yeah.
Pigment, dark circles, eye bags, puffiness, crepiness with the skin. Lackluster, I guess, and putting on, especially people that put on makeup or want to wear concealer under their eyes, it gets crepey, it gets like creasy, weird looking. So the under eyes is a really delicate area to treat because one, the skin is so thin.
Right.
Two, underneath is like a major giant bed of capillaries, and then there's not a lot of fat. Then it just goes straight to bone. So injecting under eye, like with filler, often is like a catastrophe.
Right.
I hardly ever, as an advanced nurse injector or aesthetics nurse, do under eye filler.
Right.
What we call a mesotherapy. So it basically is a blend of vitamins and peptides that help reduce inflammation, reduce puffiness, brighten the skin, and thicken the skin on the under eyes.
Okay, so it's not salmon sperm.
This is not salmon sperm.
You know how sometimes people do that?
Yeah, I do have salmon sperm. Actually, this is salmon sperm. This is called lumicin. This has PDRN in it, which is the salmon quote unquote sperm, but it's actually an enzyme that they pull from the salmon's prostate. And why it works is because salmon DNA, in terms of like the hyaluronic acid and its regenerative complexes, is 94% identical to humans.
That's so fascinating.
A lot of the times,
That's so crazy.
I know, and the science came out of how we learned about its ability to like be regenerative or anti-aging was from burn victims using actual scales and skin on tissue to repair it.
That's so crazy.
Yeah,
It's amazing what we
this has
find
PDRN.
out, what we discover.
I know. So this is the kind of the blend that I use. So I do put a little bit of PDRN in there. Again, it's not an injection. It's just going like right in the dermis.
Right.
So not filler. There's zero filler in this. This is just peptides, polynucleotides, growth factors. I like to put radiance in there because it gives like an luminate, glowy, helps with darkness. So helps with pigment, corrects the skin, makes it look brighter. And then this one is specifically for eyes, so you can think ECPR eyes. It has a bunch of peptides that are specifically for depuffing, tightening, firming, and it's literally made for eyes. This is what we're gonna need a ton of time because it's thinner.
Okay.
And then we'll wash your face, and then I'll take before photos when we're like all clean. That way we don't have any.
I'm so excited to see the difference in my smile lines too. And I like also that this is not like
Filler.
yes.
This is a natural, yeah. It's all peptides, vitamins, kind of just putting stuff where like topical skincare can't reach, and making your body do its own thing.
I feel the numbing. I feel it. Now, we were just supposed to do under eyes, but I had asked if we could do smile lines as well because I saw that's something you can do. So, we're gonna go ahead and let this numb. It's really working. I can feel it. For like 30 minutes, she said. I can't wait to show you the results.
Weird.
It was, yeah.
Took a minute to get used to, probably.
Yeah, but it was good.
Yeah.
She gave me squeeze toys. Here we go.
Squeeze toys. That's my calm along on.
This is gonna be painful if you give me squeeze toys.
That is a little bit, but I mean, remember, look at the needle. Look at the needle. You can barely see them.
Okay. She scared me when she gave me the squeeze toys.
We'll start with one, and then you can feel what it feels like.
Okay.
It's not terrible. Of course, this part is less bad.
Is the inner eye.
Yeah, the inner eye is like, I don't know how to make that good for people.
Okay.
This is the poke. So you see, barely feel the poke, right? And then this is the fluid going in. How is that?
I don't even feel it.
Yeah, see, sometimes out here you don't feel a lot of stuff, but as we work our way in.
It's like a little bit of pinch.
It's a pinch, yeah. It's as the fluid's going in, building that little bleb pinch.
Yeah, I think obviously, like you said, some areas are a little bit more, like you feel a little bit more than others, but it's not too bad.
No. And for what it's doing, tell people just think of what it's doing. We're treating this good, but you can start to see it.
Right, like when you like eat things you don't like, just remember the health benefits of this.
It's always the hardest part is getting to the gym, right? But then once you leave, you're like, thank God. This is like we're in the depths of the workout.
Right.
Our glutes are on fire right now, but just
That
like
is
building
so
a butt,
funny.
we're building our under eyes.
Do you hear that? We're building our
See
under
your-
eyes.
You see
You
your
ready?
dots forming?
Oh, look at that.
She's mutant, everybody.
I'm looking like X-Men.
Yeah. She was like, I don't want to look like X-Men. I said, you will look like X-Men today.
Right? I'm down for it. Yes, there we go. There we go. We can see them here. There.
Yeah, you see how quickly they absorb though? Like they take pretty quickly, especially if your skin needs it.
That's the best light. All right, we got photos of the smile line.
I feel like it doesn't see kind of bad.
Woo! That is spicy. It didn't hurt the eyes, but that hurts.
Yeah, because this
Oh
is
my
thinner. You can
God.
really pick it up.
Okay. We're gonna. Now this is why the squishies are good.
This is why the squishies are good. Beautiful. We're just gonna march along there. I know.
Okay, I got the squishies here.
Imagine full face.
Do people do their full face?
Yeah, it's really amazing.
Wow.
In stretch marks. Really amazing.
Woo! Under eye, not spicy. Smile lines, spicy.
Spicy, yeah. Again, it's tissue, separating tissue. Especially in areas where it's thicker, like right here.
Woo! Wiping the eyes.
You see the nice little down the line. We're gonna go back and let it calm for a second, and then we'll do the side.
All
I like
right.
to give sides breaks, because if you do too much, I feel like one side just feels heated up, and so
Okay.
give breaks.
Here we go.
Okay, my darling, ready? Burn, 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 done. Also, for whatever reason, when I switch sides, it becomes a little bit more bearable, because you're like, oh, that side's a break, and you kind of see it coming. So it's not the product that burns, because you can put this on topically. Like, we've microneedled her a handful of times, and clearly she's never said it burns. But separating the tissue with fluid and the force that we're using is kind of the pinch that she's feeling.
You didn't choose the thug life. The thug life chose you. I'm like dropping stuff now.
It's okay.
I just dropped my tissue too. We're dropping it all.
Bit of fine lines, because again, this is just a skin booster, so it's not, we're not targeting, like, she doesn't need volume replacement, she doesn't need wrinkle relaxer. This is just merely from, like you said, smiling, animating. We've earned these, but we can just thicken them a tiny bit with the skin booster. And then
Right. So it's not as harsh. Did we make it?
we made it.
Yes!
You see, you do look beat up.
I do look beat up, which is great for my profession.
I like to spray this. This is just a hypobiome mist. It just kills anything bacterial. So close your eyes. And then I'm gonna give her a face mask. We are gonna put on a teeny tiny bit of nectar, which is just good for inflammation and bringing down any risk of bruising. With this tiny bit of a needle, people don't normally bruise, but if anything, the feeling you get is kind of like an itchy sunburn feeling, because we did stretch the tissue, so your skin can feel that tightness.
Got out the fancy light. There we go. Look at that.
Yeah.
Yes, and also I have sensitive skin, so the way my face reacts will probably be different than a lot of people.
No, people look pretty beat up and bumpy.
They look pretty crazy. Okay. Walked by a ton of people outside, and I'm sure they looked at me like I was nuts. But that is just a part of the game. I cannot wait to see my results. I will tell you, it was spicy, as you could tell, to my reaction while I was in there, but I really think that we're gonna see a huge change in the results. And what I'll do is I'll try to find a photo of me without makeup prior, and then I'll show like a couple days later, weeks, to really see the full like regeneration, but at least we're gonna see something. So that was a lot of fun.